sitting here today with
Dr. Mache, Seibel.
And I am Dr. Joanne Pinkerton at the North American Menopause Society. You have interviewed so many of us about our scientific breakthroughs over the years, and in the past year you've had some health struggles, and before that your wife had health struggles. I'd like to see if you would share with us a few lessons learned from some of these health crises that you've gone through. Help us out.
Well, first of all, if things don't feel right, assume something is wrong and look into it, because just because you go in for an examination and your doctor says, oh, you're fine, and you really don't feel fine, or at least you feel that something is wrong, you need to find a different doctor to pursue this with so that you're not left without getting a diagnosis, because you can't treat what you don't know what you're treating, so you have to start.
So what happens if you start pursuing a diagnosis and you find that you actually have something, and then you get conflicting reports about what to do, or that you have to make a really fast decision? Talk us through that.
That's very challenging, because a decision that's made is not like I'm going to buy the red car or the blue car. I mean, that's an investment, but it's not really going to change your life. But I need surgery, or I need medicine, I need this form of treatment or that form of treatment. The outcome of that is not only going to make a difference, but also you can't go backwards on this. You can add it in later potentially, but you have to make a good choice. So the first thing is to get all the information. I think you have to be knowledgeable as a consumer so that you can be a partner in your health care and not just have somebody tell you what to do, because this is an instance where you have to feel the risks, the benefits, and be part of that decision.
So how does it work when it's either your partner's health or your partner, in this case your wife, is trying to help you with some of these decisions?
Well, then you have an extra set of eyes and you have an extra set of ears. Partners are great because when you're having a discussion with your doctor, most of the time, if you're the patient, you're pretty darn nervous. So if you have somebody just listening, they may actually hear something that you didn't because you feel nervous. The second thing is that if your partner, most people don't have a physician as a partner. I happen to be fortunate that I do, but whether you do or you don't, they're another pair of eyes for research, because you've really got to look into it. You can't just assume that what is told is the best decision. The second thing is that you've really got to do research on who's the best provider. You may have a tremendous doctor, but the doctor is good at A, B, and C, and you've got D, E, and F, or Y and Z. And so you've got to find the person that can help you with your problem, because many people are capable or competent in one area, awesome in one area or another, and not as much in the thing that you happen to have. So number one, find out what you got. First of all, acknowledge that if something doesn't feel right, maybe it's wrong. Second thing is to get a diagnosis, and third thing is learn about it, and the fourth thing is to go find a doctor that really is knowledgeable about that. And you have to stop at some point, but you have to be willing to put the effort in, be open, and realize that what you think or would like to happen may not be what's best for you, and you've got to put the information before your emotions, and it's not an easy task. Sometimes you just have to take a deep breath and do like Butch Cassidy, the Sundance Kid, when they looked one way and they saw they were going to get shot down, and they looked the other way and they saw the river. The river was a tough choice, but they jumped. And sometimes you got to get off your dime and just jump.
So one last question. You had almost a month of some intensive health care. Tell me something that you learned from that process that you could share with others.
I learned a lot. Number one, I realized that live in the present. If nothing is happening at this minute, and something was happening before or is going to happen, it isn't happening now. So this is a good minute, nothing bad is happening. The second thing is that I realized that my health care was being determined not only by my providers, but the doctors and the nurses, but also by the people that were bringing the food into my room, the people who were cleaning the room. I mean, I was dealing with a condition where the room had to be very clean. So actually, the woman who came in with wipes and stuff that was keeping the room sterile was actually an important player in my life. And I guess the third thing is to be grateful for what's working and not upset about what's not, because you don't know what's going to be until it happens. And I would say the final thing is stay positive, because it's not going to help you to be grumpy and moan and groan. You just have to stay positive, and you hope for the best. And
we're very happy that you are back here at the North American Menopause Society interviewing other people and also sharing your information for those of your listeners who've been watching you for years. Thank you so much.
Thank you.